What we do every day matters. We do what's called case management, physician-directed case management, which is handling the case from start to finish, picking what's appropriate, adding what's medically necessary, and answering a clinical question, not just providing a test answer, not just providing a test result. They get all the test results that they received and integrate them into one final report, which is what we call the COMPASS, which stands for Comprehensive Assessment. The mission is to tell them about that specific tumor, to tell them what their patients are likely to respond to when it comes to treatment and unlikely to respond to other medications. Also, where to expect toxicity if at all.
What really motivates people at Genoptix is doing a good job for those patients. You know, we get those samples in every day, we see the details of what those patients are suffering, and we know we can provide, good service, good testing that's going to really help them and their healthcare providers in getting them the best medicine that they can.
If there's an unusual diagnosis, if it's an acute leukemia, we call in that diagnosis. And sometimes when we see testing that is going in a direction that is completely different than what the clinician was thinking, we will call them and tell them, for example, you were thinking that this patient may have lymphoma, but what we're seeing is MDS. They want to know, what is it? How bad is it? What should I do next?
When I talk to a clinician, or when I know that I've helped them or one of the patients, I feel good. This is the reason why I went into the field that I went into, why I went into medicine and pathology. It's very rewarding to me to know that I've just helped someone, whether it's the clinician who's going to help the patient, or just through my reports knowing that the patient will have the right answer. It's great. The things I find that the clinician feels are most important when I'm trying to give a result either over the phone or just in a final report, they want a short, exact answer. They don't want any hedging. The good thing at Genoptix, we have all the resources to give an exact diagnosis. They're really appreciative they can give a call if any other questions arise and just talk to us about it. And that way, not only do they have the answer that they were looking for, but we can kind of work with them together and really find out the best options for the patient.
Diagnosing cancer is very intimate. These patients are our daughters, they are our fathers, they are our sons and brothers and neighbors.
I always try and focus on this patient's specimen as if it were my mother or my father or my spouse. And I try and put myself in that position because I always think if it were someone I loved, I would do whatever I needed to do to get the right result for that patient. And so I always try and superimpose someone I love into that patient's position to get the right answer for the patient. I really try and take it personally.
I think it's important that experts look at the cases because sometimes they can find things that are there that somebody didn't expect.
Genoptix is constantly evolving. We identify and fill gaps in the resources for practicing medicine. We have raised the bar in oncology diagnostics. That is the Genoptix way. That is our promise to you.
Join thousands of your colleagues from around the country who already use Genoptix. Genoptix is easy to integrate into your workflow. We offer a one-check option authorizing the Genoptix hematopathologist to direct and manage all medically necessary testing. And all shippers and canisters are easy to store. Plus, we coordinate and track all shipments. For all peripheral blood and bone marrow workups, choose the Genoptix way.